There we go.
My name is Tracy Yeager Jackson. I'm a family nurse practitioner and I work at Pulmonary Associates of Richmond, and I'm here to proctor Pamela Brown.
My name is Pamela Brown. I'm a Master's of Education student with Liberty University, and I will be performing the head to toe assessment today. Ms. Ricks, how are you today? Good. My name is Pamela Brown, and I'll be performing your head to toe assessment. Is that okay?
Yes.
Okay. If you have any questions, please feel free to stop me at any time. Okay. The first thing we're going to do is to assess your skin. And we're just going to look at the skin on the upper portion of your body, going to check for skin turgor, for hydration, check for any rashes or moles that may, or nevi that look suspicious. Just going to check your back, okay. Checking the color of your skin. Going to look at the skin on the lower portion of your body here. Checking the skin on your legs again for temperature and color and hydration. Checking for any rashes or any nevi or suspicious looking moles. And while we're down here, we're going to actually go ahead and check for any varicose veins. Okay, and we're going to assess for swelling or edema, which you have none. Okay, now we're going to look at your nails. Checking for any cyanosis or clubbing, checking the color. Okay, going to perform capillary refill, and that's less than 3. Great. We're going to inspect your hair and your scalp, and we're going to look at your head, going to look at the shape and the size of your head, going to look at the texture and the quality of your hair. Okay, going to look at your scalp, just inspecting your scalp. Okay, and now we're going to palpate your skull, looking for feeling for any depressions or lumps or bumps. Okay, checking your occiput, looking for any scars that might be indicative of any type of previous surgery, which you have none. Okay, and now we're going to look at your face again, checking for symmetry of your eyes and your eyebrows. Okay, and now we're going to palpate your sinuses. Any pressure, pain, or discomfort?
No.
Okay, pressure, pain, or discomfort? No. Okay, we're going to palpate your temporomandibular joint. Open and close for me. Any pain or discomfort?
No.
Okay. I don't feel any clicking or crepitus there, so we're good. We're going to now check your cranial nerve number 5, and I'm going to ask you just to perform some facial expressions for me. Going to check the motor function of cranial nerve number 5. Can you move your jaw from side to side? Can you clench your teeth? Tighten up your jaw. Okay. I want you to, we're going to check the sensation of cranial nerve number 5. Tell me whether this is sharp or dull.
Sharp. 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 Sharp.
Excellent.
Dull. 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 Dull.
Very good. Okay, now we're going to move to cranial nerve number 7. Again, I'm going to ask you to perform some facial expressions for me, and that'll give us an indication of whether cranial nerve number 7 is intact. Can you smile for me? Can you puff out your cheeks? Can you raise your eyebrows? Okay. Can you show your teeth? Okay, can you frown? I'm going to have you close your eyes, and I'm going to attempt to open your eyes, and I want you to keep them closed, okay? Okay, great. Okay, now we're going to move on to your eye exam. We're not going to perform these tests today, but I'm going to discuss them with you. I'm sure you've probably had your vision checked at a primary care doctor's office or an eye doctor, and one of the tools that he would use to do that would be the Snellen chart. The Snellen chart is a chart that gives us an idea of your visual acuity from far away. Generally, you would have that chart placed 20 feet away from you, and you would attempt to read the lowest or the smallest line that you could read most accurately with one eye covered, and that would give us an indication of your visual acuity. The other tool he might use would be the Rosenberg chart, and that is about 14 inches away, and that checks your visual acuity up close. Again, you would cover one eye, and then the lowest or the smallest line that you would read most accurately would again give us an indication of your visual acuity. Okay, the next test we're going to do is the peripheral test. We want to check to see if your peripheral vision is intact. Okay, so I want you to look straight at me, look at my eyes, or look at my nose. Okay, and I want you to tell me when you see my fingers.
Now.
Okay.
Now. Now.
Okay. The next test we're going to do is called the 6 positions, okay, of cardinal gaze, and I want you to follow my finger. Perfect. Okay, the next test we're going to do to check your vision is called the cover-uncover test. And what I'm going to do, this test checks for strabismus, and I'm going to cover one eye, and I'm going to watch for any lateral movement of your eye, of the uncovered eye. Perfect. Okay. We're going to check for the corneal light reflex test. I want you to focus on that orange bucket there, and I'm going to shine the light immediately into your eyes. Okay, perfect. Okay, the next thing we're going to do is an inspection of your eye, looking at the external structures of your eye, looking at, again, your eyebrows, your eyelids, looking at your sclera, making sure that it's white, not yellow or jaundice, as yours is, looking at your pupil and your iris, going to look at your conjunctiva, make sure it's nice and pink, as yours is. That looks good. The next thing we're going to do is palpate your lacrimal sac. Okay, and then we're going to look at your eyes to make sure that your pupils are equal and reactive to the light. Okay, as yours is. Okay. Okay, and that means your eyes are your pupils are equal and reactive to direct and consensual light. Okay, the next part of the test will be the fundoscopic test, which checks the internal organs or the internal structures of your eye. Okay. Alright. Okay, just going to look in your eye. Looking at the back of your eye. Okay. This eye. Okay, that concludes your eye exam. We're now going to look at your ears. Just going to look at the external canal of your ears, looking at your auricle, your pinna, looking for any drainage. Are you having any discomfort or pain in your ears?
No.
Okay, we're gonna go ahead and look inside your ear. Gonna look at your tympanic membrane, which should have a nice pearly white appearance, which yours does. Looking at your umba, your malleus. Okay. Okay. I'm gonna occlude one ear and I want you to tell me what you hear.
99. 13.
Very good. The next test will be the Weber test. I'm going to strike this instrument and place it in the middle of your forehead, and I want you to tell me where you hear it at. Your right ear, your left ear, or both, okay?
Both.
This is the ring test or the Rhine test, and it's also going to check your hearing, and it's checking air conduction versus bone conduction, which air conduction should be greater. So I want you to tell me when you no longer feel this.
Yeah.
Okay, tell me when you no longer hear it.
Yeah.
Okay, gonna do the same thing on the other side. Turn that way for me. Tell me when you no longer feel it.
Yeah.
And let me know when you no longer hear it.
Yeah.
Okay, great. Okay, the next thing we're going to do is to take a look at your nose. As always, we would begin with inspection, just making sure that it's midline. And then we're going to take a look inside, looking, there you go. Just taking a look inside, making sure that that mucosa is nice and pink. Okay, looking at the turbinates, looking at your septum, making sure that it's not deviated, making sure that each nostril is patent. Okay, then we're going to test your cranial nerve for smelling, and I want you to tell me what that scent is.
Vanilla.
Very good. Okay. Now we're going to look at your mouth. Again, we would start with inspection, looking at your lips, looking at your teeth. We're gonna go ahead and take a look inside your mouth, looking at the hard palate and the soft palate, looking at your mucosa, looking at your teeth. Can you hold your tongue up for me? Looking underneath your tongue for any signs or symptoms of cancer, looking at your Wharton ducts, okay? Can you say ah for me?
Ah.
Looking at your uvula, okay. Now we're going to check cranial nerve number 9, and can you just open up and say ah again?
Ah.
Okay, and we're going to check cranial nerve number 10. Can you swallow? And the other thing that we would do to check that nerve would be a gag test, but we're not gonna do that today. So we're gonna check cranial nerve number 12. Can you hold your tongue out for me? Move it from side to side. Okay, great. Okay, the next thing we're gonna do is we're going to move on to check your neck. As always, we're going to start with inspection. Okay. Can you move your neck from side to side? Well, up and down. Okay. Can you move it to your shoulder? Okay. Raise your shoulders up and I'm trying to push down. Very good. Press your face against the, very good. Very good. Okay. So now we're going to start palpating your lymph nodes, palpating the preauricular, auricular, postauricular, sublingual, mandibular, submental. Okay, we're going to palpate the precervical or the anterior cervical, post cervical. Okay, turn to the, then we're gonna look for, palpate the deep cervical. Turn to the left, turn to the right. Okay, going to palpate the supraclavicular and the inferior clavicular. Okay, feeling for the occiput. Okay, the next thing we're going to do is feel for your carotid pulse. Okay, now we're going to auscultate your carotid pulse. Okay, we're going to assess your trachea. Of course, we're going to do inspection first. Okay, then we're going to palpate. Swallow for me. Okay. Now we're going to palpate for your thyroid. Checking for any lobes that might be enlarged or any goiter. Okay. Okay. The next thing we're going to do is to assess your lungs. And the first thing we're going to do, as always, is inspect your anterior thorax, looking for any masses or bulges, looking at the rate of your breathing. Okay. And now we're going to auscultate your lungs. Every time I put down the stethoscope, just give me a deep breath. Okay, so now I'm going to do the same thing on the back, looking at your posterior thorax. Again, looking at your breathing, making sure you're not having to use any accessory muscles to breathe. We're going to go ahead and palpate for any bulges or lumps, any masses. Okay, any pain or discomfort there?
No.
Okay. We're going to palpate for tactile firmness. I'm just going to put my palm on your back. I want you to say 99.
99. 99. 99. 99. 99. 99. 99. 99.
Okay. And so now we're going to go ahead and percuss your lung fields, okay? So again, I'm going to listen to your lungs. I'm going to place the stethoscope on your back. Every time you feel the stethoscope, just go ahead and take a deep breath for me. Okay. I'm going to check for your thorax expansion. I'm going to put my hands around your back, and I want you to take a deep breath in for me. Again. Okay. Expanding. Well. Okay. The next thing we're going to assess is your cardiovascular system, or your heart. I'm going to have you go ahead and lay down for me. And as always, we're going to start with the inspection, looking for any heaves or lifts. Okay. Now we're going to auscultate the aortic area. Looking, listening for any abnormal heart sounds, any murmurs. The pulmonic area. Herb's point. Tricuspid. Apical. Okay. Now we're going to feel for your temporal pulse, brachial pulse, radial pulse, okay, popliteal, posterior tibial, okay, dorsalis fetus. Okay, very good. Okay, the next thing that we're going to do is to examine your abdomen. Okay, of course, as always, we're going to start with inspection, looking for any striae, any hernia, any bulges or masses, looking for any swelling, any fluid ascites, looking at your umbilical area. Now we're going to auscultate your abdominal area. Listening for bowel sounds. Listening for the renal arteries, listening for any bruise or rubs. Iliac. Listening for your femoral. Now we're going to percuss your abdomen. Going to percuss for your liver here. Okay. Okay. We would measure your liver. Okay. Measure the span of your liver. We're going to palpate. Okay, we're going to percuss over here for your spleen. Take a deep breath for me. Okay. adjustment. You can go ahead and sit up for me. We're gonna now assess your musculoskeletal system. Okay, I'm gonna start with your neck. Looking at your neck. Are you having any pain or discomfort in your neck?
No.
Okay. Can you turn your head from side to side? Okay. How about forward, flexion, extension? Okay. Press against my hand. Press against my hand. Okay. Very good. I'm gonna have you hold your shoulders up. I'm trying to push it down. Very good. Okay. The next thing we're going to do is to look at your shoulders. Any pain or discomfort in your shoulders?
No.
Very good. Okay. Can you, we're gonna go through the range of motion with your shoulders. Can you, let that arm up and extend it back? Do the same with the other arm. Extend it back. Okay. We're gonna abduct it away from the body and pull it across. Great. 1, 2. Okay. We're gonna check the internal rotation. Can you put your, and the external rotation? Very good. Okay. Let's check the muscle, the neuromuscular strength in that arm. I'm going to pull, and I want you to keep me from doing that, okay? Okay. Check the other side. Okay. We're gonna push, gonna try tricep muscle. Okay, very good. Okay, now we're going to check your wrist. Are you having any pain or discomfort in your wrist? No
No.
swelling or redness? Okay, very good. Okay, can you flex, extend? Okay, alright. Hold your hand down. Okay, and I'm gonna try to push it up. Very good. Very good. Hold it up. I'm trying to push it down. Very good. Very good. Okay. Now we're going to actually look at your elbows. Okay. Are you having any pain or discomfort in your elbows?
No.
Okay. Alright. We're going to do range of motion with your elbows. Okay. Can you open and close for me? Open and close. Open and close. Turn them over. Very good. Okay. Now we're going to look at your finger joints. Checking for any redness or swelling. Might be indicative of arthritis, which I'm sure you have none of. Okay. Can you open your fingers and close your fingers? Open and close. Okay. Can you make a fist for me? Okay. Can you squeeze my fingers? Okay, very good. Open your fingers for me and I'm gonna try to close them. Very good. Okay. Lay down for me. We're just gonna go ahead and check your hip. Looking at your hip joint here. Okay, and your trochanter. To look at your range of motion. Go ahead and lift this leg for me. Very good. And this one. Okay. Go ahead and turn over on your stomach and we're going to extend that leg. Check those hips. Extend this leg for me. Very good. And this one. Okay. Go ahead and roll over on your side. Bring that hip up to you. Very good. And extend it back. Good. The other side. Bring that hip up. Very good. Very good. Okay. Actually extend your legs and I want you to hold one leg up. We're going to check the neuromuscular function of that leg. Very good. Hold this one up. Very good. Okay. Gonna have you sit up on the side of the bed. We're going to check your knees. Extend that leg out for me. Okay. And all the way back. Okay. Extend this leg. And all the way back. Okay. Alright, we're going to look at your ankle joints here. Looking at the lateral malleolus and the medial malleolus. Looking at the calcaneus. Okay. We'll look at your toe joints. Any pain or discomfort?
No.
Okay, I don't see any swelling or redness. Okay, again, looking at your joints of your ankle and your calcaneus. Looking at your toes. Okay, are you able to make circles with your feet? Checking the range of motion of your ankles and the other way. Okay, very good. Okay, gonna turn that foot in, out. Okay, alright. Hold that foot pointed toward the floor, and I'm trying to push it up, checking the neuromuscular strength. Again with this one. Okay, now hold it up, and I'm gonna try to push it down. Very good. Okay, I'm gonna have you actually stand up for me so we can check your spine. I'm gonna check your vertebrae. Okay, stand up straight for me. Can you bend down and touch your toes? Okay, stand up and extend back for me. Very good. Okay, bend over to one side and then the other. Okay, are you able to stand with your core still, your pelvis and turn from side to side? Very good. Okay, I'm actually going to have you walk back and forth. I just want to see your normal walk, your normal gait. Okay, I want you to walk with a heel toe, from with your heel to your toe. There you go. You can come back. Okay, very good. Stand still for me. And with your feet slightly apart, hold your arms out and close your eyes. Just want to see if there's any type of sway. Okay, you can drop your arms. Okay, I'm just gonna check your rapid movement. I want you to touch your finger to your thumb, each finger to your thumb rapidly. Okay, and I want you to do this motion and increase your speed. Okay, very good. Okay, you can have a seat for me. We're going to now perform a test called sphericonosis. Okay, I'm going to put an object in your hand. I want you to keep your eyes closed, and I want you to tell me what the object is without opening your eyes. Okay, I'm going to put an object in the other hand, and I want you to do the same thing. Tell me what it is without opening your eyes. Just one hand. Very good. Okay. This is a test called graphothesis. I'm going to write a number in your hand. I want you to keep your eyes closed, and I want you to tell me what the number is.
30.
Okay. Same thing on this side?
8.
Okay, very good. Okay, I'm going to touch you with an object, and I want you to tell me whether that object is sharp or dull, okay?
Sharp. 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 Sharp.
Okay. Tell me whether this object is sharp or dull.
Dull.
Okay.
Dull. 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 Dull.
Okay, great. Okay, the next test I will be doing will be to assess your reflexes. Okay, just want you to hold still for me. Try to relax that arm. Okay. Relax that arm. Check your knee. Okay, Ms. Briggs, that concludes your head to toe assessment. Thank you so very much.